So hi, my name is Christina Pomaceno, and today I will be doing a presentation on pediatric burns. So for pediatric burns, they are common, but also a preventable injury within children and young adolescents. And common complications could range from scald burns to hot water, or open flames to carbon monoxide poisoning from smoke inhalation. And so because of this, the mortality rate is highest in children under 5 years old. So on the screen, I added a picture of the rule of nines for burns, which is a common rule where the body is divided into areas showing percentages of surface areas. The size of a burn can be quickly estimated by using the rule of nines, where the front and back of each arm and hand equals 9%, the chest equals 9%, the stomach equals 9%, and so on. And this can be a quick and easy tool used for the initial management of resuscitation in burn patients. So each body part has a specific number, usually 9%. So for the entire head and neck, that would be 9%. Entire right arm would be 9%. The trunk itself would be 36%. Groin is 1%. Each leg would be roughly 18% altogether. Okay, so it's important to note when a patient should be referred to a burn unit. According to the textbook in chapter 45, the indications for specialized burn unit include partial thickness burns of less than 10% of the total body surface area, burns on face, hands, feet, genitalia, perineum, and major joints. Any full thickness burns alongside the chemical and electrical burns, inhalation of carbon monoxide and or smoke, traumatic injuries, and any other children needing rehabilitation after a burn trauma or injury has occurred. And so on the side, I added another picture of the rule of nines, which explains the total body surface area. You can see how it compares from an adult to a child. Okay, so to begin, I'll start with the terminology that might be commonly used in burn units. And that's the terms first degree, second degree, third degree, and fourth degree. First degree is usually called superficial, and it's only on the epidermis, so the very top layer of the skin, as shown in the picture on the side. And this commonly heals without scarring in 4 to 5 days, roughly a week, sometimes less. And the next is second degree burns, which are also considered partial thickness and or deep partial thickness. And this affects the epidermis and some of the dermis. And this often creates minimal scarring in the span of 2 weeks, but the most damaging kinds of burns are third and fourth degrees, which are considered full thickness. And these burns affect the epidermis, the dermis, and the hypodermis. So it's including the subcutaneous layer of tissue. And these take a lot longer time to heal. And if tendons and bone are involved, this could be considered a fourth degree burn. And in those cases, skin grafts may be necessary. Taking tissue from other parts of the body, and so on. And so on the side, I have a picture of how the different types of degrees of burns can affect someone's skin. As you can see, for first degree burn, it only affects the very top layer. The second degree burn, where it also affects the dermis, You can see how it kind of affects the follicle of the hair, and then the third-degree burn all the way down to the subcutaneous tissue. Okay, so for pathophysiology, of course, the first that occurs is the burn injury itself. And due to the damage of the burn, the subcutaneous tissue starts to coagulate. And as a result, this causes a chain reaction where the body will release vasoactive substances. And that's things like histamine, cytokine, etc., as a defense mechanism. And so as the name suggests, because it's vasoactive, this leads to an increase in vascular permeability and vasodilation. And so what happens is water, electrolytes, and protein will leak out of the vasculature. And so it's very common for burn patients to experience edema in their peripheral extremities, and diuresis and fluid loss also occur, meaning there's a risk for fluid imbalances, hypovolemia, being low in sodium and potassium. And so I have also attached a diagram on the side of where the subcutaneous tissue coagulation occurs in the skin and where also cellular death occurs. And that's in the zone of coagulation, as you can see in the epidermis and dermis layer. Then the zone of stasis, which is directly below it, that's where tissue injury occurs and there's a significant compromised supply of blood. And then right below that would be the zone of hyperemia, which is where the least amount of damage is caused overall. All right, so here's my case study, which I'll read. Our patient with the initials RE is an 8-year-old girl who was rushed to the ER after suffering from a burn where hot water had been spilled from the kettle at home. Shortly after the incident occurred, her parents immediately poured cold water over her burns that were on both her forearms and a portion of her upper arms. She sustained a 15% total body surface area burn. The wounds have developed blisters and she's beginning to show edema in her peripheral extremities. Her vital signs are as follows: blood pressure of 90/65, heart rate of 155, respiration rate of 25, SpO2 of 98%, and temperature of 97.5 degrees Fahrenheit. She states her pain is at 7 out of 10, and she has no known allergies. So for the plan of care, I will begin with the overall assessment, and this includes the assessment of health history, physical examination, and also assessing the diagnostics and labs. So it's important to note the date and time and cause of the burn, and if smoke inhalation has occurred, in order to get proper treatment. And it's also good to ask when the patient's last tetanus vaccination was, because if it's been over 5 years, it's important to educate how crucial it is to have that vaccination, since a burn can create a break in the skin where bacteria can come in and cause further infection. And then for the physical exam, it's important to assess ABCs, so airway, breathing, circulation. And we should also look at the skin and note its characteristics. We're asking things like, is the skin red? Do we see any drainage? And if so, is it serosanguinous? Is it purulent drainage? Do we see any weeping, any blisters, etc.? And we also want to look at diagnostics and labs. So that's things like complete blood count, fluid and electrolyte imbalances, arterial blood gases, VQ scans, and also ECG monitoring is very important. So for interventions, it's important to act as soon as possible to reduce risk of any more harmful complications. And as said in the last slide, it's important to monitor the ABCs, airway, breathing, and circulation, alongside monitoring pulmonary status and pulse oximetry. If we see that their oxygen is low, it's important to give oxygen to the patient, and if needed, intubation may also play a role if the patient's airway is compromised, either from smoke inhalation or any obstructions within the airway. And because burns are known to cause fluid loss, and with that comes a depletion of electrolytes, especially sodium and potassium, it's important to monitor those labs and make sure that we're replacing those fluid and electrolytes and making sure that intake and output is balanced alongside their weight and making sure to take their weight daily. Proper nutrition is also important. We know that vitamin C and protein is key for promoting wound healing. And it's also important to keep the burns cool. And while it is important to keep the burns cool, we must keep the body warm in order to prevent hypothermia from occurring. Wound care should also be managed with aseptic technique. And as I said in the slide before, if it's been greater than 5 years since the most recent tetanus vaccine, we should educate the parents and the child, and we should encourage them to have them get another tetanus vaccine to prevent infection. And lastly, pain management is very, very crucial for patients' well-being, as these burns can be incredibly painful. For patient education, it's important to teach both the child, patient, and the family to be careful around hot liquids and food. Hot fluids like hot water should be kept at no more than 120 degrees Fahrenheit. As much as possible, this should be placed out of reach from children. Stuff like open flames, stoves, and hot liquids. We should also teach kids how to stop, drop, and roll if their clothes catch on fire. And burn care must also be implemented. So we should be teaching them how to take care of their burns and their wounds by cleaning it with mild soap, patting it dry, how to cover the burns with bandages, teaching them those things so that when they're at home, they can manage their care wisely. And to also let them know that giving pain management before providing wound care is also important, such as acetaminophen, ibuprofen, which can greatly help with the pain. Okay. So lastly, for evaluation, for an evaluation that indicates that the child is doing better and is meeting their goals, this includes wounds that show healing, which means like the skin is dry with no signs of infection, such as purulent drainage and fevers, that their pain is managed well, their intake and output is balanced alongside their electrolytes, which are within normal range, and showing no signs of distress or much pain at all. So for my evaluation, I put after 1 week, RE's wounds have healed and her skin is dry with no signs of purulent drainage. Her pain is managed well, intake and output is balanced, and shows no signs of distress. Okay, and these are my references alongside the textbook. And that concludes my presentation. Thank you.